Hi everyone, welcome to my evidence-based practice proposal on nursing education on patient positioning. Hi, my name is Sabrina Scova and I have worked on a high-risk labor and delivery unit for 2.5 years. I work in a teaching hospital, so I love working alongside my coworkers, residents, attendings, and midwives to provide quality patient care. I wanted to use this topic as my proposal because there's so much information on patient positioning with natural deliveries as well as high-risk complications. Over the last year, New Jersey had a 32.9% of cesarean sections nationwide. With the many of the procedures leading to complications post-delivery, numerous studies have determined that the most common problem that arises in a cesarean section needs to be performed is due to labor not progressing, ultimately leading to a prolonged first stage of labor. Nurses play a crucial role in the birthing process with various duties such as fetal monitoring, offering comfort measures, and starting interventions as labor support. Using labor positions to encourage fetal descent is not standardized in nursing practice within labor and delivery. There might be many differences in education, experience, and whether they have used childbirth education programs to promote laboring position. While there are many different alternative positions that a patient can be put into, with or without an epidural, it is necessary to keep readjusting their positions. The purpose of this evidence-based project is due to determine if standardized education for nurses will improve the outcome of vaginal deliveries and decrease cesarean sections. Background and significance. The severe maternal morbidity and mortality causing life-threatening problems for birthing mothers has doubled in the United States over the last 15 years. One of the leading causes of this increase correlates with the increased cesarean section rates that are happening with the hospitals nationwide. There are multifaceted approaches to improving this statistic, but the more informed and approachable way allows patients to position themselves and their babies for success. While there are instances where cesarean sections are necessary, they are also sometimes done as an elective choice by providers. Still, they can lead to multiple adverse outcomes, such as bleeding, infection, and complications to surrounding organs during the procedure. An alternative option to cesarean section is spontaneous vaginal deliveries that are promoted by positioning the patient correctly so the baby may find its way through the pelvis. Cesarean section deliveries can be life-saving procedures when they are deemed necessary, but they are also causing increased risk for mother and baby. There has been a trend in research exhibiting complications arising after undergoing multiple procedures. The significance of this topic allows for the prevention of primary cesarean section rates in first-time mothers as well as multipartists. Yadav conducted a qualitative research study to determine nursing professions' awareness of alternative birthing positions. Throughout this study, 52 different nurses were contacted using the convenience sampling study. In February and March 2020, cross-sectional observation research was carried out among nursing officials assigned to labor rooms in certain government hospitals in India. Most nurses were aware of the lithotomy position, which involves resting on one's back. The 52 participants answered and filled out the questionnaire that asked generalized questions regarding different patient positioning. With an average of 14 years, the nursing team was experienced. Approximately 72 of the participants reported working in labor rooms for over a year. When determining the results of the study from the employed nurses, it was correlated that 40 of the nurses were aware of the procedures and postures of other lithotomy positions that pregnant women can take after birth. The responders had a shallow understanding of several birthing positions, including standing, squatting, lateral, sitting, and hands and knees. Further research must explore and develop new ways of monitoring the mother and fetus in alternative birthing positions. However, several advantages have been cited for the squatting position at birth. The position is related to lesser pain, increased pelvic dimension, more effective contractions, and thus shorter second stage of labor. There was also an experimental study to determine if different maternal positions can progress labor through the first and second stages. These different positions included left lateral and squatting to help facilitate labor progression. Prima gravida women typically have labor develop more slowly because of their rigid birth canal. Squatting is one of the first labor positions that might accelerate the dilation of the cervix. This involved the manipulation of independent variables in a quasi-research design to establish a cause and effect link between the relationships. The study's population included all prima gravida women located through a private midwife practice. The researcher employed an incidental sampling approach to choose the samples for the study. Throughout the data, it was determined that initiating left lateral and squatting in the second stage of labor decreased the amount of time till birth. By comparison, through the non-interventional group, there was a longer time of birth for prima gravida women. This research indicates the effect of the left lateral and qualitative squatting positions of the progress of active phase of the first stage of labor along prima gravida women. Delgado performed a quasi-experimental study with a comparison research designed to determine the effectiveness of using a peanut ball with the recurring position changes in labor. As shown to the left, there are different peanut balls used for different patient heights. Most positioning used during the study included the peanut ball to open the pelvis and enable the fetus to descend into the birth canal. The hospital had an average of 100 births each month. It also had 8 labor and delivery suites. There were 343 participants, 164 women in the peanut ball group, and 179 in the control group. Following the administration of an epidural, the peanut ball was positioned. Women were relocated at least once every hour or two. The peanut ball was withdrawn during the second stage of labor, and the length was noted. 61% of women with cervical dilations of 4 cms or fewer gave birth vaginally while using the peanut ball. The peanut ball may be an effective intervention to reduce the incidence of cesarean section. Changing positions frequently was associated with reducing length of first and second stages of labor. These positions included flying cowgirl, left lateral, knees together, and finally froggy Walters. While these interventions are successful, it is important to understand through the research that progressed, it worked in conjunction. These interventions have been improved, showing that patients are able to have spontaneous vaginal deliveries. Proposed change and intervention. Throughout this evidence-based project, the primary goal is to educate nursing staff on labor and delivery of the necessary options to create confidence in promoting positioning for a laboring mother. Instituting positioning in early labor allows the fetal head to descend and make it more likely for the patient to deliver vaginally rather than they would cesarean section. The proposed change would be instituting positioning when the patient doesn't have an epidural to allow fetal head descent. Interventions include educational classes, nursing demonstrations, and handouts. EBP model. This research model is straightforward because it is a 7-step process. While using the Iowa model, I identified the clinical issue that needed to be changed within New Jersey and my specific hospital. From there, I could determine the project's purpose and how it would benefit the patients while they're on my unit giving birth. This model takes a problem-solving approach, which will help apply strong evidence about the interventions and outcomes introduced within my study. This is important and related back to my topic, as there are necessary interventions that need to be done by nurses, midwives, and medical staff. Hence, patient experience a standard vaginal delivery. Another fun fact to the Iowa method is the application of the evidence produced from the study. In this case, the evidence that backs up how patient positioning can increase a patient's vaginal delivery. Project methodology. The recipients of the EBP changes are the patients who are laboring within the labor and delivery unit. The inclusion criteria that are needed for this research study involve the eligible population of women that include any parity, prima gravida or multigravida, who experience spontaneous or induced labor within full-term pregnancies, more significant 37 weeks gestation and above. The microsystems patient population include all pregnant patients, including pediatric patients who are treated like adults and are subject to the same rules and regulations within the unit. Most of the patients that are seen within the hospital setting are high-risk patients who have some comorbidities while entering labor. The exclusion for this research study would be women who have previously had a cesarean section and want to TOLAC, trial of labor after cesarean section. My rationale for this choice is women who previously had a C-section are most likely to need a repeat C-section and do not progress quickly, as well as cannot being aggressive with their care. The population sampling would be randomized into two groups, control and interventional. The proposed setting for this project is a large teaching hospital located in the Northeast. The direct place where the project would take place is the 1 unit of labor and delivery and antepartum, where there are laboring and induction patients. Significance of nursing field. The primary goal is to educate nursing staff on labor and delivery of the necessary options to create confidence and promote positioning for laboring mothers. The findings show that educational programs successfully raise the confidence of labor and delivery nurses in all positioning. This provides the nurses with knowledge and the tools to deal with patients and their desired goals of comfort and progress. This also allows the nurses to connect with their patients while advancing their labor and ultimately helping their patients deliver their babies. Innovation. Positioning patients has become an innovative approach to labor and delivery mindset. With many programs such as Spinning Babies and Bundle Birth, they have created a platform for more nursing education. Bundle Birth Mission. At the heart of Bundle Birth Mission is the empowerment of labor nurses. By recognizing and stepping into their power, they play a crucial role in reducing the global mortality rate and enhancing birth satisfaction. Spinning Babies. Help birth givers find a way to connect with their own bodies for the profound result of comfort in pregnancy and ease in birth. We believe that pregnancy, birth, and postpartum are a sacred time for parents and babies. Thank you for watching my PowerPoint, and I hope you learned a little bit more about labor and delivery and how important it is to position our patients.